Hi, good afternoon, everyone. It's great to have so many of you joining us today. I think we actually might be a little bit of a lighter crowd because of summer break getting started, but we appreciate you making time to be with us this afternoon. We still have people kind of rolling in from the waiting room. But for those of you who may be new to these calls and don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. It's kind of hard to believe that it's already June and that we're almost halfway through this year. Ironically, the legislative break ends as soon as summer break begins for kids, which just doesn't seem fair to me. But that's what's happening now. Today is the first day of the legislative interim. If you weren't already aware of that and trying to track everything, we'll have a great update for you today about laws that are going into effect at the end of June, what to expect with the interim session getting started, and everything that you need to know about the status of Kentucky's safety net programs. I know that many of you are familiar with Thrive Kentucky by now. For those of you who are just joining us for the first time, why don't we actually advance the slide, Alex? We are a coalition of advocacy organizations. Our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians have faced historical and systemic barriers to meeting those basic needs. And for those reasons, we work with a number of principles to kind of guide our work. And that was on the screen that you just saw. You'll get all of these slides whenever, I think tomorrow is a follow-up. So you'll be able to kind of read through those. If you advance to the next slide, Alex, these are all of our steering committee members, all the members of Thrive Kentucky. And if you're interested in learning about any of our organizations, you can click on these links. And I always want to thank our sponsors for supporting this work. It really does make it possible for us to provide these monthly updates to you, making sure that you can kind of stay abreast of everything that's changing with the safety net in Kentucky, with these public assistance programs and other sort of basic needs that we are constantly monitoring and working on in terms of policy. And we really appreciate their support because we can do this for free. We can offer CEUs. And if you haven't already heard, we're not only doing our monthly webinars now and our quarterly forums with the Cabinet for Health and Family Services, we're also doing our roadshow, which launched in, was it April? We've already had two. And we are now headed to Owensboro on June 13th. And so I hope that some of you will be joining us there. And if not in Owensboro, check out the other dates and locations that we have. We're going to be doing this all the way through the end of November. And of course, we're probably going to be doing something similar again next year. We found going to communities, meeting with you all in person, and getting to really understand what's happening in different areas of Kentucky is helpful to the work that we do, and we hope that it's helpful to y'all as well. It's similar in a way to what we do on these monthly calls, but we also are able to provide a little bit more in-depth information about these different parts of our safety net, who they're benefiting, who's being left out, and so on. And we add on a really great advocacy training at the end if you haven't participated in that before. And even if you have, you'll always learn something new. So be sure to check out that link at the bottom for more details. And let's go to the next slide. This is the agenda that we're going to be covering this afternoon. During each section, if you have questions or comments, just put those in the chat. We'll try to cover those as we go. We find that that works better than waiting until the end. If we have more questions than we can get to in the chat, or as we're discussing over the next 90 minutes, we'll be sure to share answers with you in a follow-up email. And like I said, you'll be getting the slides, you'll be getting any resources that we mentioned in an email, so you'll have access to all of that. And before we begin, just some quick housekeeping. We do have a lot of folks on the webinar today, so be sure to mute your line. Use the chat for questions and comments. We are recording the webinar, so you'll get a link to the recording as well as those slides that I mentioned. And we will be sending out an evaluation as a follow-up as well. And we really do want to hear from you about what you've learned, what is most useful to you, what information you want more of, what you want less of. So it's always good to get that kind of feedback. And if you are a certified community health worker or a licensed social worker and you want to receive CEUs for attending today, be sure to reach out to Kelly. Kelly can put her email in the chat if she hasn't already. And with that, I'm going to hand it over to Dr. Sheila Schuster to get us started.
Thanks very much, Emily, and good afternoon to you all. I'm a licensed psychologist. I'm the executive director of the Advocacy Action Network, known for the Kentucky Mental Health Coalition and the 874K Disabilities Coalition. Next slide, please, Alex. So just a very brief recap. We did finish the session on March 30th. 877 bills and 71 joint or concurrent resolutions were filed. I have to laugh because it was a short 30-day session, and the word on the street was, we don't want a lot of bills filed. We don't want to be distracted from, our priorities and so forth, but still we had 877 bills and resolutions filed. 148 of those were passed and signed into law. The governor did veto 14 bills and 1 resolution, but they were overridden by the legislature, which means that they also become law. And then he kind of held his nose and didn't sign 14 bills, but they became law without his signature. So we had a total of 176. Just a reminder that unless a bill had an emergency clause, it will become law on June 29th. That date is set by the Attorney General. It's 90 days from the end of the session. In some cases, and this is a bit of a rarity, we had a bill, Senate Bill 150, which was the infamous anti-trans bill, where part of the bill, the first three sections became law under an emergency clause, but another part, which had to do with banning health services for trans kids, will not become law until June 29th. A new senator was sworn in. Senator Cassie Armstrong from Louisville was elected in a special election on February 21st to fill the vacant seat of Senator, now Congressman Morgan McGarvey from Louisville. And she serves on agriculture, health services, and natural resources and energy. We also had another senator who was not returning for a full session, and that was Senator Ralph Alvarado, who went to Tennessee to become the director of health services there. That was filled in a May 19th special election. Greg Elkins of Clark County, a Republican, was elected, but he will not be sworn in. You can't be sworn in as a legislator until the legislature is actually in session. So that will happen on January 2nd of 2024. So let's look at this next slide, which will remind you about the interim session. So we talk about the interim session where the committees of the House and the Senate meet jointly. So if you have an education issue, for instance, this is a great time to be able to talk to legislators from both chambers who serve on that committee. And those joint committees, they're called the Interim Joint Committee on Education or Health Services or Families and Children, meet monthly. They cannot pass bills, but they will take time to study some issues and revisit issues from the previous session. It's just a great time to get their attention. They're not so busy as they are during the regular session. So I put the link at the bottom there for the interim calendar. It's a great time to go up there and make connections with your legislators, but check it before you go because it changes about every week, I think. There are 7 task forces appointed for this interim, which will focus on a single topic in depth and make recommendations. And I'm going to tell you what those are in this next slide. So if we could go to the next slide. So here are the 7, and I put them in order of what I thought most of us would be interested in. One is on Health and Human Services Delivery System. So that's chaired by Senator Meredith and Representative Mead. And those are the meeting dates, and they're going to meet at 3 o'clock. If you can't get to Frankfurt, you can watch them live streamed on the LRC YouTube channel like you did during the regular session. And I put a link in there to where you can find the agenda and all of the information. So for instance, that committee met yesterday. There were a number of PowerPoints used by Secretary Friedlander and other cabinet personnel, and all of that material is there. They're going to be looking at how our health and human services are actually delivered. So there's going to be some talk about Medicaid, about the Department for Public Health. They're going to do probably some more reorganization of the cabinet. And they're also going to look at what we call the benefits cliff, which is that kind of absolute drop off when people earn $1 more than it makes them eligible, say for SNAP or for Medicaid. And we're looking for some gradual slope down so that people are not just thrown off of those benefits at the drop of a hat. One that I'm particularly interested in as a psychologist is the School and Campus Security Task Force, chaired by Senator Wise and Representative Scott Lewis. They're going to concentrate on looking at mental health issues and possible federal funding for those. They're going to go back to Senate Bill 1, which you may remember was passed in 2019 after the Marshall County shootings, and they're going to look at what was set up there, I think, in terms of trauma-informed plans and trauma-informed teams, and the requirements for a 1 to 250 student ratio for mental health personnel in the schools. Another one that's of interest, I think, because we're so concerned about the large number of Kentuckians who are incarcerated. I think we're ranked maybe top in the nation in that, and the reentry issues that come up. So this is on jails and corrections reform. It's chaired by Senator John Schickel and Representative Josh Bray. They're going to be looking at all of the prisons, not prisons, but the jails and halfway houses and so forth. They're going to see whether some of those correctional facilities need to be realigned. They're going to look at how the incarcerated population is managed, and also look at pretrial and post-conviction data. So a lot to bite off there. I don't think that, at least right now, they don't have DJJ or the Department for Juvenile Justice in there, but I wouldn't be surprised because there was so much debate in the last session over our juveniles and corrections for them, whether that might come into the discussion. So one task force is on what we call certificate of need, which is really a constraint on new or expanded health services without going through a process where the services are vetted to see if they're absolutely necessary. There are certain things like birthing centers that fall under that make it extremely difficult, if not impossible, to establish some of those health services. So they're going to look, that's Senator Don Douglas and Representative Russell Weber. They're going to look at the need for maintaining a CON for different health services and whether it should be modified or removed for some. I don't think we've had a task force on the lottery trust fund, so that's on the agenda. That's Senator Matthew Deneen, who was new this past session, and Representative Bobby McCool. And they're going to look at how those funds are being managed, and particularly look at the scholarships and grant programs. There have been a number of bills filed to change or revise the definition of scholarships that are funded by the Lottery Trust Fund. Local government annexation is apparently a hot topic, and that's going to be chaired by Senator Robbie Mills and Representative Jonathan Dixon. And they're going to look at the benefits versus the cost of doing annexation and how it affects things like utilities and taxation and economic opportunities. And then the final one, and I actually have no idea what this means, but it's called the Multimodal Freight Transportation System Improvement Task Force. And it is chaired by Senator Jason Howe and Representative Suzanne Miles. So they're looking at ports, air terminals, and freight, identify gaps in services, and look at funding opportunities. So some of you out there may be very interested in that. Again, I've listed the dates and the times when they're known, but stay in touch with your interim calendar and also with getting the materials at that link. And the next slide, please, Alex. ThriveKY is very, very concerned about what's happened with the governor's plan announced in July of 2022 to expand Medicaid benefits for 900,000 adults to improve their vision, hearing, and dental health. And so the idea is to give people the services that they need to live without pain, to enter or re-enter work or school settings, and to be able to improve their sight, their hearing, and their smiles. So the program began in January of 2023, and I've listed some of the services that are included. However, they did it with what's called an emergency reg issued by the Department for Medicaid Services, and it was found deficient by the legislature. And then the legislature in the session passed Senate Bill 65 to end the program unless new regulations could be approved. So we're caught in this back and forth, unfortunately, between the legislature, which is controlled by the Republicans, and the administration controlled by the Democrats. And unfortunately, 900,000 adults are in danger of losing these benefits. Right now, they are continuing to be able to have the benefits, but we need your help. If you have an interest in this, if you have a story to tell about someone that you know, someone you've worked with, someone in your family, maybe yourself, who has benefited or who has needed these expanded services, we would love to hear from you. There's also going to be a hearing with public testimony on July 13th. I think Kelly just put something in the chat. We have what we call a comment collector. It's real easy for you to go in there and give us a sentence or two or a whole story. And there's her email address as well. Be sure to share that. We really want to not have the talking heads at that public hearing, but for the legislators to really hear from people on the ground. And then the next slide is just a reminder that you can stay in touch with your, your policymakers during the interim. And there, of course, is the LRC website where you can get all kinds of information. Don't forget to thank them if they voted the way that you wanted them to in the last session. They seldom get thanked, and they really do love it. They particularly love a handwritten note if you're willing to do that. So I've given you the email address, the snail mail address. Call their office and identify yourself as a constituent if you are, and leave a message for your rep or senator. And then if you want to email the governor, we've given you a link for that as well. And the final thing, and you all who know me know that I can always talk about elections. So we're in an important election year. We just had our primary, and it was abysmal. Not the results, but the number of people that turned out. I think the second lowest number in the history of Kentucky voting. So we have got to do better, folks. We know that elections have consequences, and unless people show up, as the political strategists say, the elections are decided by the people that show up. So all the statewide offices are on the ballot for November 7th. On a very sad note, we lost newly elected Representative Lamine Swan, who represented House District 93. That's a new district in I think it's southeastern Fayette County. And he had served just one session, but had a medical emergency and died recently. So the governor just announced that that special election to fill that seat will also be held on November 7th. I've given you the easy govotekentucky.com to check your registration. And then I've listed for you the announced candidates for the Democratic and Republican parties for governor, attorney general, secretary of state, auditor, treasurer, and commissioner of agriculture. Do your candidate research, get involved, and spread the word to get people registered to vote. I always talk to you all about the importance of democracy, and we don't have a democracy unless your voice is, unless you speak up, and you can speak up obviously with your voice, with testimony, with notes, with emails and so forth, but also with your vote. So I'm happy to turn it over to my friend, Jessica Klein from KY Policy. Thank you.
Thank you, Sheila. Hi, I'm Jessica Klein. I'm a policy associate with Kentucky Policy. I'm going to do the economic update and status of federal relief. I'm going to start with a little preface that Dustin Pugel, my colleague, usually follows these slides. So he's leaving me big shoes to fill and lots of graphs to explain. So I'm going to do my best. Next slide. So a little update on our roaring recovery. You can see here how much we've really recovered from rapid job growth. Kentucky has recovered over 300,000 jobs since April 2020. It took us 30 months to recover from the jobs we lost, and compared to the Great Recession, it was 80 months. So we're doing really well, and we're now 2.7% above what we had in February 2020. So we're on an upward slope in terms of recovery. Next slide. And we're going to take a little look at employment. Obviously, a thriving economy requires a robust labor force where folks can earn a good living and provide for their families. So looking at job growth here, and there's you know, this graph cracks me up because you can see this is all job growth, and then the small little dip here is the whole pandemic, which we know is actually a huge amount of job loss in the peak of the pandemic, but that we've really recovered from that. And we're seeing about an average of 7,000 jobs increase every month. So that's a great number to keep growing. So we're currently at about 33,600 jobs, more than the population adjusted labor force participation rate. So that's really good. We're above normal is what we would say, but there's still a group of people left out of the labor force, and that's those that have retired, those that are caregiving either for children or aging parents. So we know that that's largely a group of women, and then excess deaths from COVID are the three groups that we've seen drop out of the labor force during the pandemic. And I think before we go on to the next slide, I'll also just add that this is really due to all of this recovery is really due to all of the supports that we've seen since 2020. And you can see that that's really where the increases start in this chart, is with all of the enhanced child care tax credit, the PPP loans, the stimulus checks, and all of those benefits that we saw throughout the pandemic, including enhanced unemployment. Which brings me to unemployment. So that'll be the next slide. So speaking of unemployment benefits, our regular state program that's been around for a very long time, about 90 years, has several special federal programs during the pandemic to keep the economy afloat in 2020 and 2021. So this chart shows that massive unprecedented swell in UI claims. That big peak there is that surge we saw, all of those long lines of people trying to get UI. And so far this year, you can see we are passing that yellow line there, which is the normal rate. So far we're far below normal levels of UI claims. And that's great news. And as a matter of fact, the number of people who need more than 1 week of assistance is about 1/3 of it was before the pandemic. So we're doing not only back to normal, but historically low rates. So that's great. But we do know that there will be future downturns, and claims are low now, but they won't always be. So that's why recent changes to UI through House Bill 4 of last year are problematic. And we know that, you know, systems upgrades, technology advances, all of that is still needed to improve our UI system in Kentucky. So next slide. Okay, that brings me to a few more recent changes that affect our economy, and that's those to our income tax in Kentucky. So our income tax is our single largest source of revenue. And in Kentucky, that means that it goes straight to our general fund and helps pay for all of these amazing public assistance programs that we talk about in this topic. So that's why it's extremely important. And it's our single largest source of revenue. And that's what makes it better, actually, as a source of revenue compared to other sources. You can see here is that it's better at growing with the economy compared to sales and use taxes. So it's actually a really good use of income tax. Next slide. But over the past few years, we've seen a series of cuts to the income tax. I'm going to kind of talk through those policies and what they mean for our income tax. So in 2022, there was House Bill 8. And what that bill did was set us up for future income taxes. Over $500 million per 0.5% cut is the impact. And it requires a vote from the General Assembly each time, including one in 2023. And it requires two conditions to be met. So the first is the balance of our rainy day fund is equal to 10% or more of general fund receipts, and the general fund receipts have to equal or exceed appropriations, so plus 1% of the income tax rate. So what this does is a double hit to our budget. It means it's a disincentive to future spending and less revenue from that general fund source to begin with. So it's a double hit. And this was just phase 1. So let's take a look at phase 2, which is House Bill 1 from 2023. Yes, so these cuts get even deeper through the House Bill 1. It's a second 0.5% cut to the income tax, and that's nearly $700 million per year. So compared to new sales taxes on services, they don't make up for a giant income tax cut, even if we were to increase sales taxes. A full percent cut equates to $18 in lost income for every $1 gained in new sales tax. So that means even an increase in sales tax wouldn't make up for income tax cuts, as you can see in this beautiful drastic chart here. Next slide. So what that means is House Bill 1 is very expensive. What it would do with this additional 0.5% cut is really take away from all of these programs that are funded by that income tax revenue that we use for our budget. So that's programs like Medicaid, K-12 SEEK funding, post-secondary education, behavioral health, universal preschool, all of those things. So again, this comes in several phases, reducing down that cut. So it allows for an additional 0.5% decrease from 4.5 to 4% starting January 2024. So more to come on all of that. Next slide. And so as I said, this cut really only helps the wealthy. As I mentioned, so this takes away from our general funds and all the programs and public resources were available to provide to people that need it the most, but also provides about $11,000 to the richest 1% on average. So the poorest million in Kentucky get nothing, while the richest 1% get $11,000 thanks to this cut in income taxes. Next slide. So in the argument, you don't have to read this slide. In the argument for this income tax cut over the past few years, there's been this discussion of that, we don't really have any needs, we just have wants in the Kentucky budget. And, after talking to lots of Kentuckians, we think that there are a lot of unmet needs in our budget. So here are just a few that we've talked about in terms of things that we could be using that additional funding for. And I'm sure that you have some that come to mind as well. So we think that there are a lot of unmet needs and that we do need that income. Next slide. So are we going to keep cutting? Again, every year, this is going to be something that comes up. This is a projection for 2024, 2025, 2026. So can we afford to keep cutting this income tax? And the answer is really no, we can't afford it. Next slide. Well, that's everything on our economic update, but lucky you get to hear me talk about food systems as well. So I'm going to switch gears for a minute from our economy and all of the impacts that that's going to have for folks into one of the resources that really helps low-income Kentuckians, and that's SNAP program, Pandemic EBT. and a few more updates on the SNAP work requirements known as time limits. Next slide. So these are the anti-hunger feeding programs in Kentucky for Kentuckians with food insecurity, which means that they don't have consistent access to enough food to thrive. So the few programs I'm going to mention are SNAP, the Supplemental Nutrition Assistance Program for low-income Kentuckians, the WIC program, Women, Infants, and Children for breastfeeding, pregnant, or postpartum women or caretakers of children under 6, the National School Lunch Program, Pandemic EBT, and Summer EBT, which make up for free and reduced meals throughout the pandemic. Next slide. So the state of hunger in Kentucky, we have about 1 in 8 people face hunger in Kentucky. That's 1 in 6 children. We also have the second highest rate of senior hunger in the nation, second only to Arkansas. So not doing great for that group either. And people facing hunger in Kentucky are estimated to need about $300 million to make up for those food needs. So it's a huge expense to help feed all of those Kentuckians, and we need all of these different nutrition programs that I mentioned to really meet that need. So yes, we do need SNAP and WIC and school lunch all working efficiently to really meet the needs of Kentuckians with food insecurity. Next slide. So this slide shows, I'm going to start focusing a little bit more on the SNAP program specifically. So this shows the monthly participation for SNAP in Kentucky. And each of the dips here are really associated with a policy change in Kentucky. And you can see 2013 is like where we start to recover from recession levels. So that means less people need SNAP assistance. And then you can see 2018, 2016, there were a couple policy changes with new governor and new administration. And then you can see the pandemic hit. So that's really the uptick there in SNAP participation in 2020. And we're starting to level out back to 2023. We have about 550,000 Kentuckians that receive food assistance currently. Yeah, so basically I just wanted to say that we're really just trying to show that SNAP is really reflective of the economy. And so each of these changes are really one reflective of the economy and policy changes. Okay, next slide. So what are ways that we can continue to improve these programs, nutrition assistance programs? And we're really looking at a lot of local innovations to do that. For example, there's the Kentucky Double Dollars, which doubles SNAP and WIC funding at farmers markets for fresh fruits and vegetables. So funding programs like that has been traditionally difficult because it uses USDA funding, which needs match funding. And this past year, we had a real opportunity to capitalize on a fund to help provide funding for programs like that, these innovative programs. And that was through House Bill 384. And what it would have done is created a Healthy Farm and Food Innovation Fund, which would have created a way to use some state and federal dollars along with private philanthropy to come together to help nonprofits to provide innovations like this, like the Kentucky Double Dollars program and others. So just wanted to say that that's a missed opportunity and one that we hope legislators will reconsider in the future. Next slide. So if those innovative programs are funded or not, we do see that SNAP participation in Kentucky really varies by county. So there's a huge need across Kentucky, but it really varies by county, all the way from 2% in Oldham County to almost 50% in Owsley County. So there's a huge variation in which counties use the most SNAP. SNAP benefits are an average of $158 per month per person. So it's not a huge amount of money. It's really just to meet kind of those very basic supplemental needs. So it does not fund full food budgets for families. And right now we have about 12.3% of Kentuckians participating, but again, really depends on the county. And all this is, again, federal dollars that we bring in through the SNAP program. And what's great is that the money is then filtered through people being able to quickly spend that money at a farmer's market or a grocery store near them. So it's really stimulating local economies as well. So that's another benefit of the SNAP program and of the innovative programs that would be funded by 384. So next slide. So there are a few, with recent changes in the SNAP program, including the ending of the maximum allotment, which really increased the amount of benefits that people saw throughout the pandemic. We want to make sure that people are considering updating their cases with possible deductions. So basically, the amount of SNAP you receive is based on your income and a few of these deductions to determine how many benefits that you get. To make sure people are getting the most amount of benefits that they're eligible for, they should consider these different deductions. There's some for dependent care costs, shelter costs, utilities, medical expenses, all of those things. So there's a little more information here on the types of deductions available. But if you haven't considered that, or if your client hasn't considered deductions, this is something to take a deeper look at in terms of SNAP benefits. Next slide. Okay, another reason that those deductions are becoming more and more important is the SNAP time limit. So the time limit is a reporting requirement that's going to be reestablished this July. This is a policy that's been in place for 25 years, but we took a break during the pandemic on this policy, so it's restarting this summer. And it's a reporting requirement for people without children or disability, currently for ages 18 to 49. And what they have to do is report at least 80 hours of work per month to DCDS, or report a exemption if they qualify for an exemption. And that's things like pregnancy, being physically or mentally unfit for work, or having participation in a school or training program, for example. And so what we estimate is that this will impact about 17,000 Kentuckians. And what we know about work requirements is that they don't work. They don't increase any work employment or engagement outcomes. What they do is take away benefits from people. Because of this additional requirement, people then will lose benefits. So it puts those benefits at risk for about 17,000 Kentuckians. We expect to start to see enrollments beginning in October, because that's when the 3-month rule is up for some folks. So the last time this was in effect, between 2018 and 2020, about 33,000 Kentuckians lost their benefits. So we do expect some people to lose benefits. And the problem may be getting worse based on this federal policy. So in the debt ceiling agreement that just passed, they included an expansion of this policy to include seniors between the ages of 50 and 54. That's about an additional 13,000 Kentuckians that are going to be joining this requirement. So we're not sure when that's going to start to be implemented. There's a lot of more details coming in the administration and implementation of that piece. So we're going to be sharing more information as that comes. Next slide. So in addition to that requirement and the group of people that are required to do that reporting, there are counties that are exempt based on the economic status of that county. So we have about 39 counties in Kentucky that are exempt, and you can see here the gray ones are exempt, and the red ones are the ones that have to do that reporting. Next slide. Okay, we're done with SNAP and moving on to PBT, and I'm going to speed it up a little because I know that I'm running over. So pandemic EBT is the program that makes up for missed school meals during the school year during the pandemic. Since the state of emergency is over, that means this is the last year this program will be in effect, but there is a version just for summer that's going to be in effect moving forward. But for this year, we do have a few more details on how this program is going to operate. So the 2 versions of this plan have been approved and one we're still waiting on. The one we're still waiting on is the round of first school aged kids. So that's children that were in school this past school year and participated in the free and reduced lunch program. The plan has not yet been approved, but there will likely be some type of application process for that group of students to apply for to receive this grocery money. So the final round of PEBT benefits has to be spent by September 30th. So sometime between now and September 30th is when we will know more about pandemic EBT for this group of people. The part that has been approved for that school year is for kids under 6 on SNAP. So they will begin to receive benefits automatically to their SNAP card starting in mid-June. So those benefits should be going out soon for that group of people. Next slide. And the good news is the summer EBT, which is, again, just grocery money for kids on the free and reduced lunch program, has been approved. So about 580,000 kids in Kentucky will receive this summer EBT funding. And that's $120 per child per month. So there are 2 phases. The first one's going to come out in mid-July, and the second is in early August is what we're looking at. So that's $120 per student for these 2 summer months coming out. And that will go directly to PEBT cards or to your SNAP card if you have SNAP. And again, there will be additional funding coming to this program for the school year, but that plan just hasn't been approved yet. So more information to come on that. Next slide. And then we wanted to give a quick update about the one type of fraud that exists in the SNAP program, which is EBT skimming. That is when somebody's SNAP card is scanned and then there's money taken out of their account. And there's lots of different ways that that can happen. Here's some examples of the different types of machines. Again, some retailers don't even know that this is happening in their store. So it's a difficult type of fraud to fight because it is kind of happening nationally. But USDA has come to a fix that they will replace benefits for people that have been scammed between 2022 and 2024. And we hope to see a permanent fix in future policy, but for now, we're working on a state plan for that 2022 to 2024 time period. So more information coming out on that soon in our state's plan. But just to take a look at your benefits for those 2 years to make sure you haven't been skimmed. And there will be some type of reporting to get replacements for that. Next slide. Okay, that skimming and some of those other pieces just bring us to the point of there's a lot of improvement to be made to both the SNAP program and to EBT cards. And so that's why the Kentucky Food Action Network, KFAN, does advocacy. So we work both at the federal and state level. There's a lot of things we'll be looking for in the Farm Bill that's coming up. Those conversations are happening federally as well. So lots of opportunities to engage in advocacy around the food work. So just wanted to share this opportunity. And now I'm going to check the chat for questions. Thank you guys so much. On back to Sheila.
Okay, thank you, Jessica. So now I'll put on my mental health hat, which never is too far from my head. And I'm representing the Mental Health America, which is actually the oldest advocacy organization for mental health in the country. So we have a very active chapter here in Mental Health America of Kentucky, and their executive director is Marcy Timmerman, a great member of the Thrive Coalition, but she's in DC at their national meeting. Next slide, please. So I mentioned Senate Bill 150 as an example of a bill where part of it went into effect right away because of an emergency clause and part has not. It's also been called by ACLU and a number of other groups the worst anti-trans bill in the country. So we know that it will impact the physical and mental health of all trans youth in Kentucky. It removes access to health care to address what we call gender dysphoria. So that would include puberty blockers and other medications under the age of 18. There are not kids under the age of 18 that are having significant surgical interventions. That happens after the age of 18. But a lot of kids that are just struggling with their gender identity don't want to go through puberty and whatever their body tells them they're ready to do. And so that's where the puberty blockers come in. They're temporary. They do not change genitalia and so forth. There was a lot of misinformation bandied about by legislators during this discussion. This bill will make it more difficult for trans kids to access mental health treatment. The original version of this bill, House Bill 470, actually by name of profession, banned all of us, psychologists, social workers, psychiatrists, counselors, and so forth, from providing mental health treatment for trans kids that would support their journey to figure out who they are, who they want to be. It makes schools much less safe or supportive for trans and even for LGBTQ students. It actually removes sex education as we know it for all kids of all ages. I think it will be a very rare school district that will try to get parental approval to do anything. It does not allow a school to provide any materials or curriculum that uses gender change, gender transition, gender dysphoria in its language. It requires separate bathroom facilities for trans students at schools, another way in which they will feel unwelcome. There are now 2 lawsuits challenging that final section of the bill that has not become law yet, which has to do with the health care services for trans kids, one by the ACLU of Kentucky and one by the Federal Department of Justice. And they have asked for an injunction to keep the bill from going into effect. So we're watchful for that. I would just encourage you all to be watchful, kind, affirming, supportive. You probably know some families that have a trans kid or a kid who's really questioning who they are. And these families are absolutely panic stricken. I was just on a Zoom this morning with some child psychologists from all over the state, and the kinds of things that families are worried about. There are families that I'm sure are looking to move out of Kentucky. We know that trans kids are 4 times more likely to consider suicide. And I will tell you as a child psychologist that I really, really am concerned about the effect of 150 on our kids. Next, please, Alex. So another aspect of our mental health work is to try to address the needs of a very different population, and that is our adults who have what we call a severe mental illness. So that might be a diagnosis of schizophrenia or schizoaffective disorder or bipolar disorder. So they are suffering and suffering long-term with sometimes a distortion of reality. They need medication and treatment. And they are probably, I think, the most overlooked group of Kentuckians with a serious mental or physical illness. They do not have a waiver, a Medicaid waiver, to provide the kinds of services that they need. And in this case, it would be supported housing and supported employment. So we got a joint resolution passed in 2022, directing the cabinet to do a waiver. Here we are, we're through the 2023 session and we still have not. They did file what they called a waiver amendment. And we were excited when we saw the title of it, but when we read it, we were not excited because it has absolutely no provisions for supported housing. So we are still waiting and advocating, and I will tell you that families and people with mental illness are getting increasingly impatient to see a waiver release that would actually provide housing and supports. By that we mean not just a roof over their head, but case management and therapeutic services available, people to check to make sure that they have access to their medications and are taking their medications. So fingers crossed, but the advocacy continues to go on for this group of Kentuckians. Next, please, Alex. So we have very high suicide and self-harm statistics in Kentucky. And you can read these 4,480 lost to suicide. The highest numbers were in that 35 to 54. I'm not going to get on a soapbox about gun control, but I will tell you that if you have someone that is a family member or a friend or a colleague or somebody that you know, and you are concerned about their depression and their suicidal talk, you need to ask them if they have a firearm available, because you need to get it out of their reach, quite frankly. The rate of people successfully completing a suicide is doubled or even tripled if they have the means at hand. If they can get the help to get through that intense suicidal ideation that we call it without acting on it, then they have a better chance of being able to stay suicide-free. An alarming increase in suicides among adolescents and college-aged Black males in Kentucky. And we know that our Black friends deal with a lot more stigma about acknowledging mental health and getting mental health treatment. And because of that, are much less likely than their white counterparts to actually seek mental health treatment. We also have a tremendous shortage of Black therapists. And I do think that, when you're looking across the room to talk to somebody about your innermost concerns, really helpful if you have somebody sitting there that looks like you and may have some of your shared experiences. There's been an increase of 100% in suicides for the 55 plus, particularly white men over 60. And then a group of Kentuckians that we have not paid enough attention to, but we're seeing increased suicide among our farmers. It's worsened by increasing debt and unpredictable weather and prices and isolation. So there's an excellent website called raisinghopeky.com that has all kinds of resources, and there's a lot of outreach going, actually starting with youth in the 4-H clubs, and then all the way up through all of the Farm Bureau and farmers get-togethers and so forth. And then again, our LGBTQ youth are not inherently prone to suicide just because of their sexual orientation, but they are often mistreated and stigmatized. And the place to go for resources is the Trevor Project, TREVOR. Next, please. So just to remind you that since July of 2022, we have the 988, which is the National Suicide Line. And I have to brag on Kentucky. It's so seldom I get to brag about something good related to mental health, but Kentucky has the best developed and most complete series of crisis call centers, because we want these crisis calls to be answered locally. So we have a statewide network of 14 community mental health centers. We call them CMHCs, and they have banded together, and there are 10 call centers answered by those local CMHCs. We also are fine-tuning the 988. We've added text and chat, which was not there before. And we know that our young people don't like to call, they like to text or to chat. We also have an automated system so that if you're a veteran and want to talk to a veteran about your suicidal thoughts or your depression, anxiety, and so forth, you can hit 1 for veterans. If you're Spanish speaker and would prefer to speak in Spanish to get help, hit number 2, and for the Trevor Project for the LGBTQ plus community, hit number 3. And then the last, and this is also good news. Next slide, please, Alex. we have still a huge number of overdoses with opioids and so forth. And you know what a lifesaver, I'm sure you've read about it, heard about it, seen it used and so forth, is naloxone. It has now been approved by the Federal Food and Drug Administration for over-the-counter use. You don't need a prescription, you can actually get it. The health departments are dispensing it. Many physicians' offices have it available. And there are some communities, I think down in the Nelson County area, that have literally a vending machine that doesn't cost you anything at a gas station where you can go and get Narcan, because Narcan is such a lifesaver, literally a lifesaver. So learn how to use it. Your local health department has classes on it, and some of the recovery, the SUD recovery programs also have it. So take care of yourself. You can't take care of somebody else unless you're taking care of yourself. So be aware of your own levels of stress and so forth, and get some help. Talking to somebody really does help. And I will turn it over to Priscilla with KBH to tell us about the Medicaid renewals. Thank you.
Thanks, Sheila. Hi, everyone. I'm Priscilla Easterling. I'm the Outreach Coordinator for Kentucky Voices for Health. And today we're going to cover some Medicaid renewal updates. Next slide, thank you. Next slide, please. Or is it just stuck on my screen? Okay, great. Back one. Okay, a little technical issue. Oh, pause, perfect, thank you. Awesome, so since we last talked, the federal public health state of emergency ended on May 11th. So officially over. It means a lot for providers and a couple of other provisions, but today we're gonna really focus on Medicaid renewals. So back in April, which is now 2 months ago, Medicaid renewals were restarted in Kentucky for the first time since March 2020. And actually this month, June 1st was the first month that Kentuckians could lose their Medicaid coverage. So it's very important. We've been talking about this for the last year or so. It's very, very important that folks have their contact information updated in their Connect account. And they can do that by updating they can update their contact information by reaching out to connectors. NCOs are reaching out to folks to let them know that their renewals are coming up. And Department of Medicaid Services is also reaching out to members, letting them know, hey, your Medicaid renewal date is coming up. We're going to send you notices. It's vitally important that people update that information, because if they don't receive one of those notices, if they don't respond to one of those notices, there's a really big chance that they could lose their coverage. So it's just so critically important that that information is updated in the system. If you're not sure how to do it, or if you need help doing that, connectors are excellent and can help do that. Or you can always call the DMS call center, DCBS call center, and they can help you do that as well. There are some unwinding resources available on the Kentucky State unwinding page, medicaidunwinding.ky.gov. And there are really great explainers about everything that's going on, resources for providers, community organizations who want to share information. They also have Spanish translations of several communications, just letting folks get the information in the language that's available to them. And then they're still currently working on other languages right now. Our friends at KY Policy put together a really great explainer if you need some more background about what's going on and all of the changes. That is linked right here. And then KVH, we also put together a one-pager front and back. We love a one-pager that also explains what's going on, what you need to do, and next steps. So those are great resources to share with consumers if you need them. So again, your Medicaid renewal dates are currently available in the system. So if you're not sure, if you have a client who needs help, or if you need help checking that out, you can do that by logging into Connect and checking it. You can call the call center, the 855-4-CONNECT, find a connector to meet with who can do this for you. Or you can also ask a provider at the doctor's office to check KY HealthNet portal, and they can check your renewal date for you. It's very important, again, very, very, very important that you check your renewal date, because over the next 12 months, next slide, please, everyone enrolled in Medicaid will receive one of these 3 notices. So these 3 notices, one is a notice of eligibility. That's going to apply for most folks. They're going to just get a notice saying, hey, your Medicaid renewal date is coming up. We're just letting you know. That's going to be due on, say, for example, June 30th, since we're currently in this month. Once you get this notice, you'll get a notice, and then they'll try and passively renew everyone and say, hey, actually, we checked all of your data system and checked it against the federal hub and data sources, and it looks like you're still eligible. So you're good. You're extended for another 12 months. You don't have to do anything else, but you're good. Once you get that notice, you can take it and put it on the fridge excitedly because you're solid for another 12 months. That's all you'll have to do with that. There are around 250,000 people who are going to receive an RFI, or a request for information. Now, this is a notice from the state saying, hey, we tried to check your information in the system, and we're not sure that you're still eligible. Some of the information might be a little outdated, or we think you might be over the income limit. So we actually need you to submit some information just to verify that you may or may not be eligible. Most of those requests are going to be requests for information, requests for income verification. And all you have to do is respond to this letter. It'll give you information on how to do that. But again, that's updating that in Connect, submitting that documentation in Connect, or mailing in that proof of your income. For another group of folks, we don't have a firm number of how many people are in this category, but they're going to get a full Medicaid renewal packet. Now, it is pre-populated with all of your information that's on the application, and they'll just ask you to go through the application and double check that all of the information is correct. If it's not, make those changes, notate all of those changes, and then sign it and send it back to them. Once you respond to either an RFI or the renewal packet, then they will send you the notice of eligibility telling you, hey, we've made a decision about your coverage. So everyone who's currently enrolled is going to get one of these 3 notices in the next now 11 months, because the first batch of renewals have already taken place last month, just a week ago, which is crazy. Next slide, please. So like I said, all of this is taking place over a 12-month period that is running from May 2023 through April 2024. Over the next 6 months, May through October, they're prioritizing Medicare eligible populations. And so they were the first folks to have their renewal periods processed, they're initiated, and they're being connected with SHIP coordinators and agents to help complete that Medicare enrollment for everyone who is not eligible. As of last count, there are around 3,300 Kentuckians who were currently enrolled in Medicaid, but did not have an active Medicare case and would be eligible for Medicare. So again, SHIP coordinators are really working to target those folks. Again, if you know anyone, this is a really great time to make sure that you connect them with an agent or a SHIP coordinator or someone to help make sure that they get enrolled in Medicare so that they don't have a gap in coverage. For this month, the population that is being prioritized is the special circumstance population. That's a group of folks who were deemed ineligible for Medicaid right as the federal public health emergency went into effect. These are around 14,000 beneficiaries. They have been manually covered every month for the last 3 years, but this month is the last month that's going to happen. So everyone's going to have to go through that renewal process. If you think that you are part of this population, DMS sent out a special notice specifically to these folks, letting them know what's going on and advising them to update the application information. So if the income has changed, if anything in the household has changed since March 2020, that was 3 whole years ago. I know for me, a lot has changed. So I think for a lot of other folks, a lot has changed in 3 years. So just making sure that you update that information and Connect and make sure that, if you're still eligible, if you have any, that you're still eligible and that you can continue your coverage without any gaps or losing it potentially. So moving into July next month and for the rest through next April, everyone else is going to be prioritized. So QHP eligible population will be engaged starting this month. So this week, the next batch of folks their eligibility is being run to see if they're still eligible for Medicaid, and those notices are being generated. This is every month, a new batch of folks are being prioritized, and we'll start receiving these notices as we go on. They are being prioritized at the case level. So again, it's a household is receiving a notice. It's not all individuals. Next slide, please. Okay, so as of May 29th, now the first batch of folks their Medicaid renewals were due by May 31st. The first response was due by May 31st. We don't have updated numbers as of noon today, but I expect those will come out sometime later this week. So we don't have a final number of how many people actually responded and all of that. But as of right now, for May 31st, there were 72,000 cases that were due for renewal on the 31st. Around 49,000 of those, over 49,000 of those were passively renewed. So that's that bucket of people who didn't have to do anything. They just received a notice saying you're extended for another 12 months. You don't have to do anything, you're good. For 22,000 folks, almost 23,000 folks, they received either an RFI or that full renewal packet, which meant that they had to actually respond and send something in. Again, we don't have a final number of how many people really did submit something, but as of the 29th, there were only around almost 6,000 of those 22,000 who actually responded. Now, we did hear from DMS that they got a rush of people who responded in the last 2 or 3 days. So I'm hopeful that number goes up. That is still a pretty low response rate. And so we really need your help, and we need everyone's help making sure that people know what's going on, know to respond, know how to respond, and if they need help, get connected to that help so that they can respond to those notices. Because again, if you don't respond, you're likely going to lose your Medicaid coverage. So just want to make sure that that's very clear. So for June, there are 73,000 cases that are due. It's a slightly different breakdown. 55,000 of them have already been passively renewed. So that's great. Those are people who don't have to do anything. They're already extended for another 12 months, but there are around 17,000 for this month that, again, they're gonna have to respond in order to keep their Medicaid coverage. Next slide. Okay, and so the great news is that DMS has a pretty robust outreach plan. They are contacting folks at least 3 times. They're calling them through the call center. They're sending out mail notices. They're also calling everyone at least 3 times, like I said. And then if they still have not responded before by the 15th of the month. So if their renewals due, say June 30th, if they have not responded by June 15th, they're also getting follow-up calls, emails, and alerts from the call center and from Connect to say, hey, please, 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 we noticed that you have not responded. Just letting you know this is coming up, so you need to make sure to do that. So far, the number that just sticks out to me, 94,000 outreach calls have already been conducted. That's just so impressive and really speaks to how well Department of Medicaid Services is trying to make sure that they're making those contacts, making sure that they're reaching out to consumers, and just trying to make sure that people get to keep their coverage. So anywhere we can help, we're trying to help. Next slide, please. Okay, so for updates like this, for more information about how unwinding is going, for other ways that you can help, DMS is hosting monthly stakeholder meetings. These are the 3rd Thursday of every month at 11 a.m. The next meeting is on the 15th again at 11 a.m. via a Teams link, which is linked here. You can ask questions. You can, again, get more information about what's going on currently. And then if you have any questions that you'd like DMS to answer specifically, you can always fill out those questions, submit those questions through a survey that is linked here as well. Next slide. Okay, so now let's say you are one of the folks who either went through the process and was found ineligible, or you didn't respond and you got a notice saying, hey, your Medicaid is ending. What do you do? So you have a couple of options. The first option is to report any changes. That is the simplest option. If you get that letter, and you're like, wait, I think I might still be eligible. All you have to do is go into Connect and update your application. You can reach out to a connector, or you can call the call center and have them and walk through your application with them to report any changes that might have happened in your income or household since March 2020. I worked with someone on Friday who got a termination letter, and all we did was update his income, and now he's extended for another 12 months. It was super simple. It took 20 minutes, and now he is covered for another 12 months. So that's the first step that you should take. If after reporting changes, they're still saying, hey, you're not eligible, then ask for a reconsideration. If you have updated your information on all of that, you have 90 days from the loss of coverage to request a reconsideration. And if they approve it, then they can reinstate you into your existing MCO without any issue, without any coverage gaps or issues. If after that, you ask for a reconsideration and they still say, no, you're ineligible, well, you have 120 days to request a fair hearing. Kara just dropped the link in the chat. And if you think you're still eligible, if you disagree with their finding, you are well within your rights to request that hearing, and you should. So Kara dropped the link and how to do that, and I will also put that on this slide for the future. So that's what you should do. But if after all of that, you're still not eligible for Medicaid, you can ask to have your benefits continue pending the hearing. So that's a great way to make sure that you're not missing out on accessing any care that you need in the meantime. Next slide, please. So if after all of that, you still have not been able to get back enrolled in Medicaid, you're not actually eligible, you don't think you're eligible, and now it's time to start thinking about moving plans. Well, the other option is a QHP, and there are lots of ways to get enrolled in a QHP outside of open enrollment. Open enrollment typically runs November through January 15th of the year, but outside of that, there are special enrollment periods. There are 4 different types. There's the first one that we'll talk about is the qualifying life events. And so that's stuff like big life changes, getting married, having a baby, moving, or just losing your coverage. And a big one that I'm highlighting here is that loss of Medicaid coverage. If you lose your Medicaid coverage, you are eligible for a special enrollment period on Connect. The really great thing about this specific special enrollment period this year is that it's running from now through July 2024. So if you lose your coverage at all, if you lose your Medicaid coverage at all in the next 13 months, you are eligible to enroll in a qualified health plan through the special enrollment period. One of the other special enrollment periods is a low-income SEP. And this is really for families who make around 150% of the federal poverty line, which is around 20,000 or 41,000 for a family of 4. And it makes folks eligible to enroll in a plan on Connect at any point, any month during the year without having to experience a qualifying life event. So just based on your income, you can enroll at any point throughout the year. And you can apply for both of these types of SEPs on connect.ky.gov, or you can find a connector to help walk you through that application and answer any questions. Next slide. The third type of special enrollment period that we're going to talk about are exceptional special enrollment periods, exceptional special enrollment. And that's really for any other circumstances other than a traditional qualifying life event. So it being incapacitated, affected by a natural disaster, domestic abuse and violence, experiencing spousal abandonment, all of those are exceptional special enrollments. And you can qualify for this. You can qualify for these by just applying. You can apply by emailing connect.esc@ky.gov or mailing a statement to Kentucky Health Benefit Exchange. And then the fourth type is Medicare special enrollment. This one is specifically for folks who are age 65 and older, who are otherwise eligible for Medicare, but did not enroll during their initial enrollment period. And these special enrollment periods allow folks to enroll in Medicare without having to pay that late enrollment penalty, which is a lifetime penalty. If you miss that initial enrollment period, you're permanently paying a higher premium for your Medicare coverage. So these special enrollment periods will really help folks get into Medicare without having to pay that penalty. And again, one of those ones that I'm highlighting is the termination of Medicaid eligibility. So as soon as you're no longer eligible, you can get enrolled in Medicare without that late penalty. And you can apply for that, for these special enrollment periods on ssa.gov. Next slide. Okay, we're going to roll through these last couple ones. There is a new feature on connect.ky.gov called Get Contacted. And this button in red that is circled it really connects folks with agents to help with QHP enrollments. This is not specifically to get help for Medicaid or SNAP enrollment or anything like that. It is specific to QHP enrollment. And just as a reminder, licensed insurance agents are paid a commission to assist with QHP enrollments. They are excellent at doing that, and that is their main role. Certified connectors are free resources, but they help with applying and enrolling in Medicaid, KCHIP, KHP, QHPs, SNAPs, CCAPs, and all of the other programs that are available on Connect. So there's just a difference. Agents are paid to help you, and they're a great resource to do that, but connectors are a free resource, and they can help with all of these other programs. Next slide. And as I say that, there are a lot of folks who are going to be making this transition between Medicaid and QHP coverage. And because of that, we're also hearing a lot of news about scam alerts going on. There are two types, really. One, they're just scammers who are calling folks trying to get their money, who have no plans to offer or anything like that. But then there are also junk plans. These are not great plans. They're what we call short-term limited duration plans that do not offer ACA compliant coverage. They don't cover essential health benefits, and they often don't cover much at all, but they are generally pretty cheap. So folks can sometimes be enticed by the low price, but in practice, they don't really cover much. So we're really just making sure that folks know that there are only 4 ACA compliant carriers in the state of Kentucky: Anthem, CareSource, Passport, and Ambetter by WellCare. So anything outside of that, just buyer beware a little bit. And if anyone ever calls you saying, hey, you want a health insurance plan, don't be afraid to ask them to send you something in the mail. So ask them to send you something in writing. And if nothing else, you can always ask them for their insurer license number. And most people will hang up before they try and give that to you. So just so that you're aware. Next slide, please. Okay, and then last, just a quick update. You might have heard about the ACA lawsuit. We've mentioned this a couple of times. The Fifth Circuit has put a decision's effect on hold while they consider a motion for a longer lasting stay, and that motion was heard today. Essentially, this affects preventative services only, really specifically. Most of the types of care people are most likely to lose are no cost coverage for cholesterol medications, PrEP coverage, breast cancer risk reducing drugs, screenings for hepatitis, and others. What you really need to know right now is that nothing is changing right now. Your insurer is still covering everything as they should, as preventative care rules are required, but we will update you once we know more and once that decision has been made. So just so that you're aware. And that should be it. So turning it over to Adrienne. Thank you.
Thanks, Priscilla. All right, I'm Adrienne Bush with the Homeless and Housing Coalition of Kentucky, and I'm going to take us almost to the end. Next slide. Okay, so I just wanted to highlight that we do have preliminary data on the January point in time count that was done in 2023. And as you can see, the trend lines continue to go up from the low point in the height of the pandemic. And that probably reconciles with your experience in your communities. And then the other piece that I wanted to share with you all is that the trends in terms of where people experience homelessness in the Commonwealth continue to hold true, where almost 30% are in Louisville, 18% are in Lexington, and a little over half are in what we call the balance of state in one of the other 118 counties. Next slide. I also wanted to share with you the National Low Income Housing Coalition published its Kentucky housing profile. And this is a helpful snapshot kind of where we are as a state. You can see that we are short almost 90,000 homes for our extremely low income neighbors and family members. And then I also wanted to let you know that there is additional information at the link available by updated congressional district, post redistricting. And then soon we will have the out of reach report, which highlights the mismatch between wages and housing costs. So stay tuned. Next slide. Okay, so what remains of pandemic housing assistance? We do have some emergency rental assistance, but it is quite different from what it was a couple of months ago. So we know that the Healthy at Home Eviction Relief Fund publicly closed to new applicants. In Louisville, we have a couple of resources that I wanted to highlight. I would encourage folks to continue to visit stopmyeviction.org and then check out the Housing Stabilization Program, as well as the Urban League's Emergency Deposit Assistance Program. Next slide. In Lexington, they still do have emergency rental assistance. There are some additional parameters on it that weren't there before. But eligible tenants may still receive financial assistance with up to 12 months of past due rent, up to 3 months of future rent, and then payment of a security deposit, and up to 3 months future rent if an eviction goes through and they have to relocate to a new unit. Next slide. Okay, so across the balance of state, just so you know, we do maintain a contact sheet of known homeless service providers by county and area development districts. And Kentucky Housing Corporation did make some emergency rental assistance available for prevention purposes to some of its homeless service providers. So if you are curious about what is available, I would encourage you to check that out. Next slide. The State Housing Finance Agency also has kind of morphed the eviction relief program into an eviction diversion program. And this is a court-based program. It's for tenants with an active forcible detainer complaint. It can provide 3 months past rent paid directly to the landlord, a security and 2 months future rent paid directly to the new landlord if the person has to move. The portal did launch on April 13th, and KHC staff will be in court in certain courts in certain counties. Next slide. All right, the Housing Assistance Fund for people with mortgages, that still remains. So we want to make sure that people know that that's available if you are behind on your mortgage or have people who are. Next slide. All right, and then the federal update, as you all are aware and we kind of touched on, the debt ceiling legislation that passed last week. I think a lot of us are still trying to sort out the implications of what that looks like. But here's some helpful parameters for folks who are thinking about housing. One of the things that it does is cap federal spending programs non-defense discretionary at fiscal year 23 levels into fiscal year 24. And then in fiscal year 25, it allows only a 1% increase across agencies. So this is much less than the initial gambit proposed in the House by House Republicans, but it's still not great. And part of the reason is, as somebody alluded to at the beginning of this meeting, the cost of housing keeps going up, rents keep going up. And when you have folks who are lucky enough to get rental assistance, when those rent contracts increase year over year, you're basically any sort of flat line or reduced increase, it just acts as a cut because you can't renew as many people. So if you think that is an issue, I encourage you to check the link when you get the slides. There is a sign-on letter that some national folks are organizing. Next slide. And then lastly, state legislative update, couple of highlights. We're monitoring the implementation of the Rural Housing Trust Fund. We're monitoring the implementation of the Homeless ID Bill and hope to have good information for you on how to access that in July. Our policy priorities for 2024 will include additional disaster housing trust fund monies because the need is still there. There's still a ton of unmet housing need. And there are a couple ways you can participate in helping shape this response. One, there is an open survey for residents in Eastern Kentucky. And two, USDA at the federal level actually does have some disaster home repair money available now that people can apply for. So check out that link. And then over the summer, we will continue to work on eviction expungement. So if you're interested in that work, holler at me. Next slide, and I think that's back to Emily.
All right, thank you, Adrienne, and thanks to all of our speakers for all of the great updates and information you shared today. Just want to wrap us up. Let's go to the next slide. What you see here is what we always provide, just an easy place to go for resources and links to some of the things that we've shared. Do remember to take a look at our schedule for Thrive Kentucky, our webinars, and go ahead and register for future webinars if you have a chance now, and then also for our roadshow. And share this information with anyone in your network who you think may want to join us. And just a couple, let's skip that slide. I also wanted to mention, here's our perennial Advocacy 101 training recording if you can't make it to something in person, but we hope you can join us for our abbreviated trainings that we're doing during the roadshow. The last slide I wanted to show is, I think the next one, yes, more resources for advocates and consumers. No, the one before that. This is the image of the Medicaid renewal explainer, and we have it in English and Spanish. Priscilla mentioned that. We are going to have other explainers very soon on childcare, on housing, on SNAP, and some other KTAP, many of these safety net programs that we've been talking about today. And so watch for those. And I'll just say, please look for the email with all of these resources tomorrow, as well as that evaluation. And we would really appreciate if you could give us your feedback. And I hope that you'll join us next month. So thanks, everybody. Have a good one.